Today we will perform the pulmonary exam. The patient should be draped to comfort throughout the exam. Beginning with the posterior chest, the PA will inspect for any deformities, asymmetry, or retraction of the chest wall. Next, she will inspect for rate, rhythm, and effort of the patient's breathing. During palpation, the PA is noting for any tenderness or masses on the patient's posterior chest. The PA will then place her hands on the patient's back at the lower border of the ribs and request the patient take a deep breath, feeling for even expansion of the ribs. She will then perform tactile fremitus. She will place the ulnar surface of her hands at 4 locations bilaterally on the posterior chest.
99.
The PA will instruct the patient to say 99 for all locations. Percussion is performed in a ladder pattern down the posterior chest, listening for symmetry. Percussion is also used for diaphragmatic excursion. The patient is instructed to completely exhale, and the PA will percuss for tympany to dullness to find the location of the relaxed diaphragm. The patient may breathe normally, and then is instructed to fully inhale while the PA percusses to find the location of the contracted diaphragm. This should be performed bilaterally, noting the right diaphragm should be higher than the left due to the liver. The measured difference between inhalation and exhalation should be about 5 to 6 centimeters. The PA will use a stethoscope next to auscultate breath sounds in the same pattern by which the percussion was performed. The patient is instructed to inhale and exhale through their mouth each time the stethoscope is placed in a new location on his back. The PA is listening for adventitious breath sounds such as wheezing, rales, or rhonchi. Three more sets of auscultation are performed in the same ladder pattern. With bronchophony, the patient is instructed to say 99 with each movement of the stethoscope. An abnormal finding is if 99 is heard clearer in one location.
99, 99, 99, 99, 99, 99, 99.
With egophony, the patient is instructed to say E. An abnormal finding is the E sound becoming an A sound.
E, 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 E.
With whispered pectoriloquy, the patient is instructed to whisper 1, 2, 3. An abnormal finding is hearing the whisper clearer in one location. Positive findings for all of these tests may indicate consolidation in the lungs. Moving to the anterior chest, the PA will begin with inspection, once again looking for any deformities, asymmetry, or retraction. Inspection is followed by palpation for masses or tenderness. The symmetrical ladder pattern for percussion is performed on the anterior chest, followed by auscultation for adventitious breath sounds. This completes our pulmonary exam.